How to eliminate lower back pain by working on the hip. My name is Dr. Turchaninov and I am founder of Science of Massage Institute located in Phoenix, Arizona. In this short video, we will discuss clinical case of the patient who came to our clinic with chronic lower back pain, unsuccessful months-long therapies by different medical professions, chiropractors, physical therapists, acupuncturists, massage therapists. Unfortunately, all these therapies did not bring him stable clinical results. Patient came with the chronic lower back pain and he complained it bothers him on the left side, and he was visually tilted, and only what his complaint was is the pain in the lower back and nothing else. During evaluation of the patient, we noticed that his left lower extremity was in outer rotation. What you see right now is a very simple test on the screen. We ask him to put feet together and open his knees. And when he opens his knees, you can see clearly that on the left side, abduction was dramatically restricted. So this is first indicator of early stages hip osteoarthritis. In many cases, patients don't complain even about pain in the hip joint. They complain in the lower back pain, in the lower abdominal pain, and that's exactly what happened with our patient. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future. So very simple abduction of both hip joints allow to suspect that that's not lower back issue. We asked him to go to his primary care physician, who indeed did X-ray of the hip joint, and radiologist confirmed presence of the hip osteoarthritis, early stages with osteophyte or bone spur formation. Right now, what we did, we actually, instead of working in the lower back, we, for 3 sessions, decompress his left hip joint. Decompressing left hip joint eventually make this test equal. You can see that in the picture right now, because abduction right now equal on the right and left side. While switching to the lower back, we continue to work on his left hip joint. And what you see picture right now is the outcome of entire therapy. Patient right now don't have lower back pain, and you can see here that his left hip is now in the more abduction, that even hip he did not complain about any pain on the right side. So for successful decompression of the left hip joint, restore normal mechanic of the body, then brain take protective tension and roadblocks in the form of the lower back tension, and now having 1 or 2 sessions of the lower back protocol completely restore function. Because patient originally didn't have lower back pain as an initial cause. It was secondarily reaction put around his hip joint by the brain in the form of restriction to protect already compromised joint. And that's what actually give patient chronic lower back pain, while in reality it was early stages of osteoarthritis which trigger lower back pain in his scenario. However, there is another critical outcome of therapy, because by decompressing his left hip joint, we slow down of osteoarthritis development. So right now he's a relatively young guy and he maybe need hip replacement in the future, but maybe not, because right now with doing correct stretching, exercise in the swimming pool, inversion table, he maintains his healthy hip joint, and we slow down or even stop further progression of osteoarthritis of the hip, and in many scenarios it actually avoid hip replacement surgery or push hip replacement surgery further in life, when surgery becomes only one and is not require another hip replacement due to the failing and the prosthesis. So from that perspective, I would like you to see bigger picture in the clinical symptoms, because what you see frequently is not the actual cause, but the consequence or secondary reaction established by the brain. Let us know what you think about situation when abnormality in the function of the hip joint or in the knee joint actually create lower back pain, and this lower back pain misled other therapists to fixing the consequence of the problem instead of addressing the actual cause. If you have any experience with that, leave your comments below and we can have productive discussion. Thank you for watching, and let's work together to bring your practice to the new level of medical massage therapy. I hope you enjoyed this video, and let's see each other in the future. Thank you.